Everyone in the gym at some point is either going to have a sore elbow, sore knee, sore shoulder, sore back. Something I want to teach today is the flexion extension rule. So say, for example, we take the elbow. If it hurts flexing, so bending, what we can do is some very high volume of extension, so strengthening the arm. So just for example, let's pretend you got a sore elbow. When you bend it like this, what we're going to do is take a band. And so if we just go here and we're just going to go 50 to 100 reps. And so what we're looking at this is if we got pain bending our elbow, doing a lot of high volume work on the extension or the straightening of the elbow, what it's going to do is flush a lot of blood into that area. One thing with tendons is they like a lot of volume but load. And so if you're getting pain this way, what we don't want to do is continuously load that. We want to actually unload it by loading the opposite. So this is what you call antagonist muscle groups. So basically it's the opposite. When you load this, it's going to take load off the other side. And it actually makes it feel really nice. Good thing about it, all of the blood flow going into that joint, it's going to help speed up the healing process. And tendons respond well to lots and lots of reps. So it will strengthen and thicken that tendon really quickly as well. So that's for the elbows. Now, let's say you've got a back issue. So let's say Ash leans forward, touches her toes, and she gets a sore back. So this is, once again, flexion pain. What we want to do is train extension. So she's going to put the band just below her knees. We're going to train the hip extensors so that it takes pressure off flexion on the lower back. So if Ash just slide on the ground, a couple of ways we can do this is one, having a bit of abduction, so bending the knees. So having a bit of abduction, so she just pushes the knees out, switching on her hip extensors, hip external rotators, which then is going to take the pressure off her lower back. So if she goes 30 reps, what we're looking for is until it burns. So about 20 to 30 reps here. And then what this will quite often do, and especially if you're a coach or something, you'll find someone walks in, they can barely touch their toes. They do 30 reps of this. All of a sudden, they're very flexible. They've got no pain. And they're like, what have you just done? You're a bit of a wizard. But actually, all it really is because they got a flexion pain, you train extension, so the opposite. It actually just gives them some relief and allows their muscles that are tight, spasming, or feeling a bit upset to relax and allow for more movement. So jump up. So stay there. Let's pretend you had extension pain. So leaning backwards. What we want to train is train the trunk flexors or the abs. So something like this. So if Ash lies down on her back, something as simple as a McGill curl up. So she straightens one leg. What she's going to do from here is she's going to activate her abs. And then she's going to do a little crunch. And with this, see how Ash is using her neck here? What I want her to do is come down, try to poke her chin to the roof. Just use your abs. Just there. Hold where it's shaking. Go down. So go a little bit slower and try to push your abs through the floor. Hold there. And so Ash just has a weak trunk. Okay, so over time, let's say Ash is getting a sore back. All we need to do is train her abs. And so people misunderstand training the core, but it's really useful in certain situations. So just think, simple rule of thumb. If it hurts bending your knee, do a lot of leg extensions. If it hurts extending the knee, do a lot of curls. So good rule of thumb, the flexion extension rule for pain management.